Hello, gentlemen. If you're over 50, 60, or beyond, and you've noticed that your moments of intimacy feel different, specifically if you experience the full sensation of pleasure, that moment of climax, but without the expected presence of seminal fluid, this message is absolutely essential for you. Maybe it happened just once and instantly triggered a knot of worry in your stomach that hasn't gone away. Or perhaps it's a recurring, silent issue you've been keeping to yourself, feeling a sense of shame or a quiet fear about what it might mean for your health, your masculinity, and your future. I'm Dr. Nerita, a urologist with 12 years of experience focusing on men's vital health at every stage of life. And today, I want to have a serious but profoundly supportive conversation with you, one that doesn't dance around the topic or leave you with more questions than answers. First, and most importantly, I want you to know that I understand your concern. The change you're noticing in your body is not a sign that your masculinity has expired or that your intimate life is over. It is not a verdict on your worth as a man. Think of it this way. It's not a failure. It's a detailed message your body is sending you, and that message simply needs to be decoded. Stay with me, because in the next few minutes, we're going to explore the surprising causes, the critical warning signs you absolutely cannot ignore, and most importantly, the clear, manageable solutions modern medicine offers to restore your peace of mind, your confidence, and your overall well-being. Before we dive into what happens when the fluid is absent, let's take a quick, non-textbook look at how this process should work normally. Think of your body's reproductive system as a perfectly timed orchestra. The testicles produce the sperm. The seminal vesicles contribute the bulk of the nourishing, rich fluid. And the prostate adds a protective, alkaline fluid that helps everything survive its journey. This final cocktail is gathered and prepared in the urethra, waiting for the moment of release. When climax hits, specific muscles contract in a powerful, rhythmic sequence to propel that fluid mixture forward and out. It's a rapid event, the result of delicate, synchronized timing between nerves, glands, and muscles working together in perfect harmony. Now here's a crucial distinction, gentlemen, and I want you to really hear this. Climax and ejaculation are not the same thing. Climax is the neurological sensation of intense pleasure, governed by your brain and your nervous system. Ejaculation is the physical act of expelling the fluid. Most of your life, they have happened seamlessly as one unified event, but they are driven by separate mechanisms. Understanding this distinction is the first step toward releasing the shame and fear that often accompanies this change. Our focus today is on dry ejaculation. This is the technical term for when a man reaches climax, feels that characteristic pleasure, but notices little to no fluid is released. It's often described to me in my office as an empty orgasm, and I can hear the frustration and confusion in my patients' voices when they say it. This gap between the expected and the reality fuels worry, and I get it. You've always expected a physical sign of the event, a tangible proof of your experience. But it's vital to understand that your ability to feel pleasure can remain completely intact, governed by your nerves and brain. The change is in the mechanical delivery system. This doesn't mean you've lost your virility. It simply means part of your body's plumbing has a specific, identifiable reason for the change. And that reason is almost always manageable. Quick pause before we count down the main causes. If you find this information helpful, please hit that like button to tell YouTube this video matters. Subscribe to join our growing community of men who are taking charge of their health, and drop a comment below. Tell me, where in the world are you watching from? I love seeing this brotherhood of men supporting each other across continents. It genuinely lifts my spirit. Now, let's break down the 3 most common causes of dry ejaculation. Knowing the why is the first step to feeling in control and taking action. Number 1, the gatekeeper is too relaxed. Retrograde ejaculation. The single most common cause of dry ejaculation is called retrograde ejaculation. Here's the biology behind it. Picture a small muscular valve, a gatekeeper, at the exit of your bladder. During climax, this valve should clamp down tightly, ensuring the seminal fluid only has one way to go, forward and out. If this valve is too relaxed, the fluid, following the path of least resistance, flows backward into your bladder. You feel the full pleasure of climax, but since the fluid doesn't exit, it feels dry. The practical clue that this is happening is a common, non-alarming sign. You might notice your urine is cloudier right after intimacy, as the fluid is now mixing with it. The practical cause of this relaxation often happens after certain surgeries on the prostate or bladder. The procedures are successful and necessary, but they can affect the delicate nerves controlling this gate. It's also a known side effect of specific medications used to treat conditions like high blood pressure or an enlarged prostate. The medicine works on the blood vessels, but it also relaxes that tiny muscle. I remember a patient, a very proud man in his 60s, who was distraught after a successful prostate surgery. He felt like he had lost a part of himself when he understood it was purely a mechanical alteration, like a traffic light being stuck open, and that his desire and ability to feel pleasure were completely unaffected. He felt immense relief. That relief is available to you too. Number 2, the plumbing is blocked. Duct obstruction. Our second major cause is an obstruction of the duct through which the seminal fluid passes. The biology here is straightforward. The seminal vesicles and other glands are producing the fluid normally, but think of the small ducts as delivery pipes. If these pipes are blocked, the delivery vehicle can't pass. The volume drastically decreases or disappears, even though production is fine. The practical causes of these blockages can include the scarring left behind by past infections, such as a severe, untreated prostatitis. Rarely, small calcifications, like tiny stones, can form and block the passage. The practical signs to watch for are subtle, but some men report a new, mild discomfort in the pelvis during climax. Or they may have noticed that the fluid has become progressively thicker and less abundant over a long period. The excellent news is that many of these obstructions can be cleared, often with medication to manage inflammation, or, if needed, minimally invasive procedures to restore the normal flow. This is not a life sentence. It's a plumbing issue, and we fix plumbing issues every single day. Number 3. The fuel is low. Hormonal factors. The third major area to investigate is the hormonal factors, specifically low testosterone. Here's the biology. Testosterone is the primary fuel for the male reproductive system. It doesn't just regulate desire and sperm production. It is crucial for the optimal function of the prostate and seminal vesicles, which contribute the bulk of the fluid. When testosterone levels drop significantly, the entire system slows down. The emotional impact is profound. Initially, you might notice a reduction in fluid volume, but over time, this deficiency can show up as decreased libido, less firm erections, and a generally less intense sensation of climax. On a broader level, men often experience fatigue, mood changes, and loss of muscle mass. The practical solution is straightforward. This is often a condition called hypogonadism, a treatable hormonal deficiency. If a simple blood test confirms the deficiency, carefully managed hormone replacement therapy can often restore not only better fluid production, but also energy, desire, and overall quality of life. It's a mistake to just chalk this up to getting old. I've had men in their 70s come back to me after treatment and tell me they feel like they've been given a second chance. That's not hyperbole. That's the power of getting your hormones right. While most of the time these causes are manageable, as your doctor, I must also address the critical exceptions. Dry ejaculation can sometimes be a red flag for a more serious condition, which is why paying attention to accompanying symptoms is crucial. When to see me immediately. If dry ejaculation appears suddenly and without explanation, especially if it's accompanied by pain, blood in the urine or fluid, fever, or a loss of sensation in the genital area, do not wait. These are signals that require an urgent urological evaluation. Conditions like certain neurological diseases like Parkinson's or uncontrolled long-standing diabetes, or in rare cases, specific urological cancers can interfere with the plumbing or nerve signals. I'm not telling you this to scare you. I'm telling you this because early intervention is everything. The men who do best are the ones who come in early, when the options are plentiful and the damage is still reversible. Beyond the physical, we cannot ignore the profound emotional toll this takes. Many men equate the presence of fluid with their performance and virility. When it disappears, feelings of inadequacy, anxiety, and frustration can take root. It's common for men to start avoiding intimacy out of fear of being judged or feeling incomplete. They pull away from their partners. They stop initiating. They quietly suffer. The emotional reassurance I want to give you is this. The most important step to breaking the cycle is information and communication. Understanding that this is a physiological change, not a personal failure, lifts an enormous weight. Your ability to feel pleasure, have erections, and enjoy connection does not solely depend on the presence of fluid. Your intimate life can and should remain a source of joy. I've seen marriages saved because a man finally had the courage to talk to his doctor and his partner. I've seen confidence restored. I've seen men look in the mirror and see themselves again. To wrap up, I want to leave you with a clear, supportive action plan to take back control. Number 1, don't ignore it, investigate it. A sudden or progressive onset of dry ejaculation warrants a visit to a urologist. A simple history, physical exam, and often a blood or urine test are all that's needed for a clear diagnosis. Number 2, control the underlying conditions. Keep chronic conditions like diabetes, high blood pressure, and cholesterol in check. These directly impact the vascular and nerve health that controls the whole process. Number 3, break the silence. Talk openly with your partner and your doctor. Talking about what you're feeling is liberating and paves the way for solutions. Remember, professional support, whether it's a medication adjustment or a specific treatment, is your best tool for restoring confidence. In summary, gentlemen, the absence of ejaculation isn't the end of your intimate life or a verdict on lost masculinity. It is a signal from your body that deserves to be heard and investigated with the help of a professional. Understanding the cause, whether it's mechanical, obstructive, or hormonal, is the first step to finding peace of mind. I've seen countless men regain their confidence, their vitality, and their joy in living after receiving a clear diagnosis and action plan. Your vitality isn't measured in milliliters of fluid, but in your health, your well-being, and your ability to live fully and connect deeply. Don't let doubt or shame stop you from seeking answers. Acting in time can change everything. I'm Dr. Nerita. Take care of yourselves, gentlemen. I'll see you in the next one.